So let me tell you about the time I did my first pelvic evaluation and I was scared out of my mind. So let me set this up for you. I was 26 years old. I was about to go look at somebody who was 6 weeks postpartum, and I had never done an internal examination on a patient who was pain. When you become a women's health physical therapist, you do many pelvic evaluations and assessments while training. So I sit down, I talk with them, we do the questionnaire, they sign the waiver saying they don't want somebody else in the room, that they feel comfortable, that they know that I am going to look at their pelvic floor. So I step out of the room, I allow them to undress, I have them put a sheet over top of their lower half, and I say, okay, I'm going to be right back, I'm going to come back in, let me know when you're ready. So I give her a few minutes to get ready and change, and then I knock on the door and she says, okay, come on in. And I'm like, okay, put my gloves on, consent again, eye contact, she's ready, let's do this. Meanwhile, I have sweat rolling down my back, giving myself a pep talk that I could do this. I believe in women's health, that I am not scared. I am scared. I am scared. I am not scared. I am scared. So we're just talking. So here we go. So I lift up the sheet to see what I see. It looked totally awesome and fine. Like, it did not look like it had been to war. It did not look like she had birthed a watermelon out a hole the size of a lemon. I was in shock. I learned a valuable lesson that day about tissues and healing in the woman's body. I learned that a woman can come back from anything. If a watermelon can come out the hole the size of a lemon and 6 weeks later look like what I just saw, hell, we could do anything. And I say this to you because I was scared. As a person who hadn't had a baby and it was my first exam, I'm like, oh, what am I going to see? How bad is it going to be? Wasn't that bad? And I worked with that young lady for 2-3 months, and she healed and she was lovely and her pelvic floor strength returned. But it taught me a lesson that women can heal. So if you're pregnant and you are worried about your pelvic floor and you are worried what it's going to look like after having a baby, have hope, because I think you will be shocked how much your pelvic floor can heal. Now, I am not saying immediately after you just had a baby vaginally, because that's something different. Even a bad zit takes 2 weeks to heal. You got to give it some grace. But I had seen my patient 6 weeks postpartum. And now I see people 2 to 4 weeks postpartum. And actually, let's do one more. I treat people while they're pregnant, prep them for this, and by the time they have their baby, they already know what they're doing and they hit the ground running because we have a plan. I find it much easier to lead with a good offense than come in with a defense. So my women know before they give birth what they're going to be doing: stool softeners, habits, posture, breathing, exercises, what they do 2 weeks, what they do 4 weeks, and by the time they come in and see me, we're ready.